Tavia Fergus, and I am a healthcare administration student. This presentation is about healthcare accessibility and disparities, administrative solutions. This topic is important because access to healthcare affects every aspect of a person's life, physically, mentally, and socially. And as future healthcare leaders, we should understand how administrative decisions can reduce disparities and help create a more equitable system for all patients, and access to healthcare is not equal for everyone. Healthcare accessibility continues to challenge systems across the United States. The Agency for Healthcare Research and Quality defines access as the timely use of personal health services to achieve the best health outcome. Why access matters? It matters because access isn't just about whether hospitals or clinics exist, it's about whether care is actually reachable, affordable, acceptable, and appropriate for each person. As a future healthcare administrator, I see our role as more than managing systems. We're advocates who connect policy, people, and practice. My goal today is to explore how administrators can reduce healthcare disparities through policy reform, workforce development, technology integration, and community partnerships. Healthcare disparities exist across race, income, geography, and disability status. According to the 2021 National Healthcare Quality and Disparities Report, Hispanic adults are less likely than white adults to have a usual source of care, and Black and Native populations face higher uninsured rates. These gaps are not random. They reflect deeper structural issues like poverty, segregation, and unequal funding. Understanding these disparities helps us identify where administrative leadership can make the biggest impact. Some of the main barriers to equitable access include insurance and cost, provider shortages, cultural mistrust, and digital divide. High out-of-pocket costs make people delay care. Rural and inner city areas often become what researchers call health deserts, places where care simply isn't available. Cultural and trust barriers also play a huge role, especially in communities historically mistreated by the system. And finally, telehealth access isn't equal. Without broadband or digital literacy, technology can widen gaps instead of closing them. In the healthcare sector, administrators hold multiple levers for change. The framework I'm using includes five key strategies: policy and insurance reform, work diversification, technology and infrastructure investment, data driven decision making, and community partnership. These tools work best when they're coordinated, when policy supports equity, when the workforce reflects the community, and when data is used to measure progress and not just productivity. Expanding insurance coverage and reducing cost barriers are the most direct ways to improve access. Administrators can advocate for Medicare expansion, streamline eligibility, and promote most value-based care models that reward quality over quantity. Aligning reimbursement structures with access goals ensures that organizations have both the mission and the means to prioritize equity. Policy reform isn't just a government process, it's a leadership process that starts inside healthcare institutions. Representation matters. A diverse Culturally competent workforce improves communication, trust, and care quality. Studies show how patients treated by providers who share their cultural background report higher satisfaction and better adherence to treatment. Administrators can promote this through equitable hiring practices, mentorship programs, and cultural competency training. Addressing internal bias isn't just the right thing to do, it's a measurable strategy for improving outcomes and patient trust. Telehealth, mobile clinics, and hybrid care models have transformed how people access care, but only when implemented equitably. Administrators can partner with broadband providers, create digital literacy workshops, and install telehealth kiosks in the undeserved areas. During COVID-19, these tools were lifeline, but we learned that technology must be accessible, affordable, and easy to use for everyone. Looking forward, digital innovation should go hand in hand with digital inclusion. Administrators can't fix what they can't see. That's why data is one of the most powerful tools for equity. By using analytics, organizations can identify exactly where access gaps exist, whether by race, income, geography, or disability. Navesque five dimension models help guide this process by focusing on approachability, acceptability, availability and accommodation, affordability, and appropriateness. Integrating equity metrics into performance dashboards ensures accountability and long term improvement. When administrators align their organizational strategy and staff incentives with these equity goals, progress becomes measurable, not just aspirational. Mm. Healthcare doesn't end at the hospital door. It's an experience when systems meet people where they are. Partnering with community health workers, local nonprofits, and faith organization helps build a culture of trust and awareness. Administrators can use community partnerships to co-design programs that reflect local needs like mobile vaccination drives, health fairs, or patient navigation programs. When the community is part of the planning, solutions become more sustainable. Some case examples or best practices. Several organizations are already leading the way. First, the Mobile Health Unit Initiative reduced no-shows and improved chronic care management in rural areas. Secondly, a culture navigation program connected non-English speakers with bilingual patient navigators, reducing readmissions and improving satisfaction. And third, community partnerships and workforce equity programs showed how leadership diversity can directly improve directly can improve patient trust. Together, these examples prove that when administrators lead with empathy, innovation, and data, equity becomes achievable. While these strategies are effective, they come with challenges. Limited budgets, stakeholder resistance, and systemic racism can slow progress. To move forward, administrators should embed equity metrics into performance dashboards, invest in digital literacy, strengthen cross sectors collaborations like housing and education. The future of healthcare leadership lies in empathy based, data driven decision making that keeps the community voice at the center. Access to healthcare is more than availability. It's the ability to receive timely, affordable, and appropriate care. Administrators bridge the gap between policy and people, turning vision into action. As a veteran and aspiring healthcare administrator, this work is deeply personal. I've seen how access or the lack of shapes entire lives. Equity isn't a one-time goal. It's a continued commitment to inclusion, innovation, and accountability. If we commit strategically and empathetically, true health equity isn't just a dream, it's within reach. Thank you.